Well, good morning, everyone. Thank you for coming. I'm going to use my big girl voice. Can everybody in the back hear me? No? Okay, well,
Your audience.
Let's see if we can get a microphone in here. Dan, can you help me out here? I'm gonna project the best that I can. I'm a singer, so I'm gonna use my opera voice to try to get the back row until we get a microphone up in here. I'm Colonel Heather Yoon. I'm the Deputy Commander for Medical Services at Brooke Army Medical Center. And I'm happy to be here. It's my first time ever to the ARC, although we've been taking care of patients from the ARC for many years. And you know, every year we have Retiree Appreciation Day, but this year we were thinking about it, and we're still going to have Retiree Appreciation Day, but it's not entirely fair to always make the retirees go to BAMC. Sometimes we can go to where the retirees are. So, you know, we've spent a few years going through a time of a lot of transition at BAMC. I'm going to walk back and forth a little bit too, just to get my voice to the back. You know, the last few years, what have we been dealing with in the San Antonio market for healthcare? Well, we had this little thing called a pandemic, which I think you all are aware of. We had a DHA transition, so it's not just Army medicine and Air Force medicine anymore. Now all of us work in healthcare for the Defense Health Agency, and we transitioned to that. We brought BAMC and Wilford Hall, the 59th Medical Center, together as a market. And then we also rolled out a new electronic health record. So MHS Genesis, maybe you've heard of. How many in here have been on the MHS Genesis patient portal?
Or try.
Or try. Okay, there you go. There you go. Yeah, so not everyone's been successful, and there have been some headaches in trying to get access to that. So we've had a lot of initiatives over the last few years trying to make sure that we keep up with this transition, but also that we help our patients keep up with this transition. So that's really why I'm here today, is I wanted to make sure in 2023, the beneficiaries who are retired know what can they expect from the San Antonio market. What can you still access from us, and how do you access it? So, you know, most I think here are probably over 65, so probably fall into the TRICARE for Life category,
Yeah.
right? TRICARE for Life. Does TRICARE for Life have any bad names? Does it have any, like, you know, abusive words that we use to describe that? Not that we use to describe it, but I see some shaking heads, right? So, you know, how many in the room no longer have primary care in the military health system? If you do not have primary care in the military health system, raise your hand. Yeah, so it's almost everyone, and that is because by congressional law, we have to take care of active duty, we have to take care of active duty family members, we have to take care of prime patients that are recently retired and family members, and TRICARE for Life, we just don't have space for most TRICARE for Life in primary care in the San Antonio market. Is that changing anytime soon? I don't think so. I mean, I don't want to lay the primrose path for you, and maybe I'm wrong. I hope I'm wrong. But just because you don't have access to primary care in the San Antonio market does not mean that you don't have access to everything. How's this? Nope.
Not yet.
Check. 1, 2, 3. Shouting Yoon time almost over. We're going to have a microphone. There's some kind of awesome background. Okay, now it's just me. Can you hear me now?
Yeah.
Okay. Should I drag this thing up closer to the front?
Yeah.
Yeah, so we don't get cervical injuries from looking over our shoulders, Doctor. Okay.
Yeah, put that on the stage.
We'll put that on the stage for maximal dissemination. How's this? Do y'all hear me in the back?
Up.
That's as loud as that's going to go.
It's as loud as it's going to go.
Okay. Keep it close.
Okay, we are in business now. So, again, I'm Dr. Heather Yoon. I'm Air Force Colonel at Brooke Army Medical Center. That's how it goes these days. Somebody made a joke about SAMC coming in here. We don't call it that anymore either, so it's back to Brooke Army Medical Center. So, you know, what did I want to come here really and convey to you today? Just get through some of these transition times that we've been talking through the last few years. So the San Antonio market, what is it? So Brooke Army Medical Center, yes. Wilford Hall Medical Center, also yes. And there are 10 other clinics around San Antonio that are also part of the San Antonio market, including Randolph, which is probably the closest one here. So between all of those, we have actually over 100 specialty services and about 11,000 providers. So again, it's a universe of healthcare besides just primary care. The next thing really was just to convey that access to care is really our number one challenge and number one focus in the San Antonio market right now. So, the focus of all of our efforts is trying to get patients connected to care. And we have some access to care, basically handouts that we have brought with us that we will disseminate here today. I don't think it's enough for everybody that's here, but we will come back with some more, and we will also email out there's a QR code that you can scan. So when this thing gets updated, you'll have an updated version if you download the QR code and you have the website. So we'll come back with some more of those. So how are we trying to deal with access to care challenges? One, there's a big effort on recruiting and retention, and I won't get into the weeds of that for you, but the whole healthcare environment has changed post-COVID. We're also leveraging a lot more telehealth than we used to. Telemind and Doctors on Demand are great resources for us and for you. TRICARE patients are eligible for those things, and they can do virtual behavioral health on the spot if you need it, and kind of virtual urgent care. We are promoting the MHS Genesis patient portal, and after this briefing is over, I'm happy to entertain individual questions in the lobby, probably where it's a little cooler, about how to connect with resources to help you get onto the portal. And then we've initiated some more user-friendly access to information. How many follow BAMC or the 59th or the San Antonio Market on Facebook? Anyone? Okay, well, 3 people, and you probably noticed that we got hacked, and we've had lots of weird videos recently, and we've sustained a lot of mockery on the web for our inability to prevent getting hacked. But there are also a couple of new text messaging services that our beneficiaries can sign up for if you want real-time information about what's going on at BAMC and Wilford Hall. And then we have some new initiatives. How many use pharmacy services ever at BAMC or Wilford Hall? So, a fair minority, actually. When we transitioned to MHS Genesis, it was kind of a major speed bump for pharmacy, wasn't it? Yeah, we know. And we did everything that we could to try to mitigate it. And I'm happy to tell you, you could tell me too, but it's a lot better than it was in January of 2022. Any corroborative nods out there? Anybody willing to? Yeah, so at BAMC in particular, we've got this Queue Anywhere, so you can get your prescriptions activated before you pick them up just by using a text message service. And we have these lockers too, where you can get your refills sent and never have to even interface with the pharmacy at all. It's all done remotely. So those are pretty cool. One of the other cool things about MHS Genesis and the pharmacy benefit is that now, me sitting in my clinic at BAMC, I can put in a prescription pretty easily to the mail order pharmacy or to CVS or HEB. And also your civilian doctors can put in electronic pharmacy straight to the BAMC or the Wilford Hall pharmacy. So we didn't used to be able to do that with our old EHR. So that actually is kind of an upgrade. In terms of navigating your healthcare, CAMO, our consult management office, is still the same phone number it always was. And they're the best for kind of scheduling appointments and specialty services. The patient portal we talked about, the nurse advice line, this is all in the handout. And then increasingly there are freestanding urgent care centers all over the city, freestanding emergency rooms that can be used. And we still have the ERs at BAMC and Wilford Hall. I meet a lot of people who are retired, even flag officers who don't know that they can still get hospitalized at BAMC and they can still go to the ER at BAMC or Wilford Hall when they want to. And that is technically space available. I'm here to tell you that there will always be space available at the ER and on inpatient services at Brooke Army Medical Center when you need it. And that is one thing that I just really wanted to foot stomp here. Even if you get sick in the night and you want to be taken to the closest ER, maybe it's a freestanding ER, maybe it's Methodist or something. If they tell you you need to be admitted to the hospital, you can say, well, I want to go to BAMC. And they'll take you to BAMC unless it's like, well, they can't because you're like literally dying at this moment and they have to take you straight to the catheterization lab or something like that. But BAMC is there for you as an inpatient service, and we want to be there for you as an inpatient service. So you can always request that, even if you get admitted to a different hospital, and then they're like, well, you're going to be here a while, you're going to need surgery, you're going to need cardiac procedures, this and that. If you raise your hand and say, can I go to BAMC? Can I get transferred to BAMC? They will look into it, and likely you can get transferred to BAMC if that's of interest to you. And I bring that up because I think, one, people don't know it, and two, is this an even better microphone? Is this even better? Oh, it sounds luscious. Okay, this one will turn off. Pretty soon, pretty soon. It does include dependents. Yeah, no, pretty soon I'm going to be singing show tunes with this excellent microphone. Okay, so back to inpatient services at BAMC. If you're in a freestanding emergency room or you're even admitted to another hospital, you can go there. Why would you want to? Well, we think we're pretty good. And our patients think so too. So when we look at our hospital survey scores, they're kind of the top-notch hospital survey scores in terms of patient satisfaction, level of care. We know it from the comments that we get from people, just that the kind of personal attention and the kind of nursing ratios that you get are excellent. We know from the services that we're able to provide that are really top-notch and world-class that you're gonna get like super specialized care by people who are committed to the mission, that like love to take care of you, and that's why they're working at a military hospital. And we know it because still, even post-COVID, a lot of the civilian emergency departments and inpatient services are just backed up. And if you go to the hospital and they're like, we're going to admit you, you still might sit in the emergency department for 3 days waiting for that to happen. I don't know if you've ever had that experience, but it's pretty common. That doesn't happen at BAMC. So I just want to let you know, like, it might take 10 hours on an off day to get you a bed, but that's an off day and that's an outlier. And mostly people get a bed within a few hours if they need to be admitted to the hospital. Now, if all your records are at Methodist or wherever, is that a little bit of a pain? Yeah, it's a little bit of a pain, but it's not an insurmountable pain, and we can get your records, and we do this every day. So please keep us in mind for that. Okay, other things, yes, the text service I told you about, we're gonna hand out these handouts, including with the QR codes where you can scan this and get all this information just on your phone and not have to like remember a piece of paper to drag around. BAMC has its own website, Wilford Hall has its own website, and then the San Antonio Market has one. Our town halls. We do access to care town halls. We have another one coming up next week. It's August 21st. I think that's 31st, it's next week. And these are live streamed on Facebook, and they're also in person at the BAMC auditorium. So if you have access to Facebook and you would like to be in that town hall and kind of hear about all the updates and also ask questions in real time, you can do that. And if you sign up to get our text messaging service, you'll always find out about those things because frequently we'll do them whenever there's a big update and something that we need to tell our patients about. Other things, just beneficiary services. So, TRICARE for Life is what we have when we're over 65, and we have Medicare, Part A, Part B. And as I said, so bennies can seek care on a space available basis for surgical, specialty, emergency, and inpatient care services. So I already talked about emergency and inpatient care. What about surgical and specialty care? Can you ever get that, really, at BAMC or Wilford Hall? Yeah, you can. It depends. It depends a lot on what's the surgery and what's the specialty. If it's a screening colonoscopy, it's probably not going to happen because they have plenty of screening colonoscopies just in active duty patients and other people now that the age is less than, the age is less than 50. But in general, the more complicated the thing is that you need, the more likely it is that we can do it at BAMC or Wilford Hall, and that we want to do it at BAMC or Wilford Hall. So we want to do those things because we're trained to do them. We want to do those things because we're equipped to do them. We want to do those things for you because you've earned that benefit. And we also want to do those things, frankly, because that's what keeps any medical team that's doing those things sharp and at the top of their game. It's the complex stuff, right? So if all we do is sick call, are we gonna be ready to go downrange and do our job when we get a lot of complicated surgeries? That's not the thing that makes us ready to do complicated surgeries right downrange. It's doing complicated surgeries at Brooke Army Medical Center and over home. So how do you access that? How do you find out? Well, again, if it's inpatient and you need it and you're there, you're gonna get it. That's not the issue. If you have an outpatient thing, say you recently got diagnosed with, God forbid, pancreatic cancer or some really bad cancer surgery is in your future, reach out, okay? If you need a transaortic valve replacement, that would be a thing to reach out to us about. And there's a phone number here, basically a fax number, and if they fax the referral to our fax number, then Camo will get it. They will send it to our specialist to review, and you more than likely with a complicated surgery or procedure can get seen in one of our surgical clinics. Specialty clinics, it's kind of the same thing. So some of them, orthopedics is always deferring lots of patients to the network. It's probably less likely for orthopedics except for joint replacements, which they always are doing joint replacements in people over the age of 65. But things like, infectious diseases and endocrinology and rheumatology and a lot of these subs, if you need them, it's worth checking because sometimes we have capacity. And once you're kind of in our specialty service pool, it's likely that you're gonna be in that pool for a chronic condition for the duration. So those are the brief notes. We have the slide deck that's available that we can disseminate, and then we have these access to care guides. It's not enough for every single person in this auditorium, but we will come back with more. I did not anticipate the bold showing that you all would make, even without the show tunes and the 100-degree heat in here. So that, I'm gonna keep this briefing short just because it is so hot, but I'm happy to take any questions. Yes, ma'am.
You mentioned lockers for prescriptions. Where are those lockers?
So at BAMC, if you walk in kind of that main ambulatory, the clinic side entrance, they're right on the right, like that big atrium where all the radiology waiting is.
Would there be any possibility of getting a set of lockers here, since you have quite the population that most of us use either Randolph Pharmacy or BAMC Pharmacy?
That is a good question, and I don't know the answer to it.
I'm just
And
putting it out
I
the
will-
wind to take it back.
I think, patients that are at Randolph Insurance, if you're enrolled there and you can use the pharmacy there and pick it up, generally there's not a long wait, but I can take that question back and ask about it.
Well, we have some people that can't get to Randolph easily or anywhere, so if the lockers were here and
No, that's a fair question. And is anyone here using mail order pharmacy? Yeah, so that's the other option, is that's real convenient. There is a copay, however. Yes, ma'am.
Would you please repeat the question? We can't hear the question.
Okay, great, I'll repeat the question. That question was, the pharmacy lockers, can we put them at the ARC? And the answer was, I don't know, but I will take that back.
Maybe in once a week?
Let me look into it and get back to you guys. Yes, sir.
Can you get a tutorial on how to work them?
On how to work the lockers?
Yes.
Did you have a struggle?
Yes.
Okay. Yeah, we can work on that.
Because I think the rules have changed since they originally put them in.
Okay. Yeah, there's some kind of thing that walks you through it when you pick it up. I didn't have a struggle myself, but
I have no doubt.
I have heard of, if I'm hearing of people struggling with that, then that's something certainly we can make sure we've got a tutorial at the ready when you need it. Yeah.
Thank you.
Dan, are you taking notes? Yes, sir.
You have a process for referrals for specialty care. So can an out-of-network provider access your system? In other words, can a civilian doctor send your team a referral?
Yes, so the question is, how does a civilian doctor send a referral to our specialty care? So if you're over 65, the pathway is this fax number. And that is basically a workaround that we have come up with to try to make sure, because Camo doesn't, if you have Medicare, Camo doesn't have anything to do with the referral management for that. But if you use the fax number, that gets you into the queue for our referral management for them to look at it and consider on a space available basis. Because we already have a process as kind of a right of first refusal
for TRICARE Prime patients that, you know, maybe have a civilian PCM. And that gets you into the queue for that right after the process. Good question. Yes, ma'am.
When you activate a pharmacy prescription and your prescription is still current, how do you get the prescription that you activated? Because I don't, you know, I mean, you don't have a number to call in for that prescription number.
You're saying if you already have a prescription and you need a refill, how do you activate it?
No, you gotta, because you're at the end of a current prescription.
Mhm.
And you got a new prescription and you get it activated. But how do you get that new prescription that you activated?
They'll tell you to get it.
The question is, how do you get a new prescription that you've activated? And, you know, my experiences and what they say is the process is you just go pick it up. And they
Yeah.
tell you,
But you can't pick it up because you've activated the prescription.
Mhm.
And it's time for you to activate that prescription to get the new one. How do you get it? Because you have no number.
At Randolph, you text, get in line.
I know.
I have the answer, I think. If it's over 2 weeks old, that prescription, you have to go in and physically go in and ask them to activate it at the clinic.
so if you activate it and you never picked it up, and
No.
it's like 3
If
weeks
this
later.
prescription's over 2 weeks since it's been, they won't.
Since
Yeah, that is a wrench in the works. I'm not sure that's what your question
No, it's
is.
not my question. You have a current prescription and you have like a month left on it.
Okay,
And you go to your doctor and you get a new prescription because you're having that appointment.
okay.
And you text, get in line, and you activate the new prescription, but they won't fill it because you already have a month left. So you're left in
Okay, I'm
limbo.
understanding the question now. It's about like you already have a month left of your prescription and so they won't actually fill the new thing. That's a good question. I'll take that back and we'll circle back around with an answer for you on what the process is supposed to be there. It's a good question.
I did this and I know it works. If the prescription is written more than 14 days ahead of time, and if you have enough medication that goes beyond that, they won't fill it until you're down low, you know. So what you have to do is physically go to the clinic to activate it.
Okay, well, anyway, that's a point of feedback for us. That's a process improvement I can bring up with our pharmacy, because I don't think the intent is to like make you activate the prescription multiple times and then show up to the pharmacy and go through all this hoopla. So I'll take that back. Yes, ma'am. Yes, ma'am. Yeah, so the question is, if you go to an outside PCM and they want to send a consult, will they have the fax number? I think most of them don't, and that's why I'm giving it to you. I'm giving it to you so you can give it to them, or if you get the referral, then you can fax it to Camo. But the fax number here is the same fax number for all of the referral management in San Antonio. So we're advertising with the folks that are out there, but there are so many civilian PCMs and different PCM offices. So we're just trying to make sure we cover all the bases and let you know what that fax number is too.
What is the fax?
Yes, if you want me to read it to you, I will. It's also in this slide deck and on the handout. It is 1-877-875-0095. That is for referrals to specialty care from an outside PCM. Again, it's 1-877-875-0095. Great. Yes, ma'am.
In the past, we were able to renew our medication refills online. Is that ever going to be possible?
Yes, the question is about renewing meds online, and this is a major crazy maker with the Genesis patient portal that we have all complained about also. We don't have local control over it, but it is something that DHA is aware of, and we understand that they plan to fix that in the future so that we can renew those things online. When that will be, I would not make any
Reorder,
promises.
renew.
Yeah.
You can renew.
Any other questions?
You can. He'll
Yes.
let your doctor do it for you.
Yeah, yeah.
I don't, how in the world can I get on without them telling us you've gone too long or you've tried too often and without success?
So getting into the MHS Genesis patient portal, this is a comment and a question, and the comment is it's a bad user experience. And we know, I mean, we have lived the same life of that transition. We are giving all the feedback. We kind of were the first big place to undergo the MHS Genesis transition, honestly, because they started on the West Coast. And so it was smaller places like Madigan and San Diego that got it first. And now even Walter Reed has gone through the MHS Genesis transition. So I think the changes that we will see to improving the user experience with the patient portal will be forthcoming. Now for in the meantime, like individual user experiences, we have an MHS Genesis person basically assigned to BAMC and to the San Antonio market who can interface with you and help individuals get through their problems. His name is Calvin Williams, and we'll make sure you get that information on how to get in touch with him. The other thing, all of our MSAs, our front desk people, are going through MSA University, and they are supposed to be understanding and being trained on how to help patients with MHS Genesis patient portal. So that's another resource that you can ask. Another resource that you can ask if you're, next time you come to BAMC or Wilford Hall and you're like there for some other reason, is patient advocate, and they can help you get connected to the right people to help you with the portal. I'm happy to also stand around in the lobby for a while after this and like look at your cell phone with you and try to help you figure out what, if you're fat fingering something, or like why is it asking for your mortgage 30 years ago. I don't know what your mortgage was either. I had to guess on mine also. So, any other questions? Yes, sir.
What is Genesis?
What is Genesis? Good question. So MHS Genesis is the new electronic medical record that the military health system is using. And it was designed really to be one ring to rule them all that the VA was going to use also. Basically, the VA is calling it something else. It's a Cerner product. And they've been slowly implementing it across the military health system for the last several years. But we transitioned in San Antonio to that about 1.5 years ago. So that has been a significant lift to get everybody trained and get all your records kind of re-imported into that. We still have access to older stuff that we can see through kind of the ancillary legacy system, but it has a lot of different workflows and things associated with it. It's been a big learning curve for the organization and for all the patients. But when patients are referring to MHS Genesis, mostly what they're talking about is the patient portal. So that's the current version of TRICARE Online, which we all used to use. Yes, ma'am.
Can you get a GP at BAMC?
Can you get enrolled in primary care at BAMC? The answer mostly is no, with a little asterisk on it that sometimes there are exceptions if people are aging out or if there's something going on, if you're actively going through cancer chemotherapy at the time that you age out or something like that. But I don't want to make any promises about space being available in primary care because I don't see that in the current trajectory of where the DHA is going. It's really what I want to make sure y'all are aware of is the specialty care and emergency and inpatient care that are available to you. And then all the ancillary services that people can still use that maybe you got turned off of in January of 2022 when you came by and it was like a circus in the pharmacy and you were like, I'm never coming here again. Give us another try. It's much better now. Yes, ma'am.
For your, personally, what would you recommend we keep as far as past medical records? Some of us have 40 or 50 years. What can we really shred or get rid of?
The question is how long to hoard the stacks and stacks of paper from medical records of years. That is a personal decision, ma'am. Some of us are hoarders and some of us aren't. I think for me, all of that stuff with 30 years ago would probably be in the shredder by now. I can't see a doctor rifling through like 18 binders of whatever you've got there, but make sure you've got, the thing that as a physician that I want to know from the patients can be fit on like a note card when you come to the ER. and one side of it is your med list. Better yet, have all your prescriptions in a Walmart bag or something that I can rifle through and be like, why do you have 2 bottles of this same one? And are you taking these both, or is one of these expired? You know, help us help you in that regard. And then just like a problem list of these are my chronic medical diagnoses, these are the surgeries that I've had, these are the allergies that I've had. That kind of stuff is really valuable to us when we're meeting you for the first time, especially if we don't have all your records because they're in somebody else's health system. But you don't need to drag your wheelbarrow with all of the papers in it. Sometimes people do. Yes, sir.
If you enrolled in Genesis at another military hospital, does BAMC have access to that information?
If you enrolled in Genesis at another military hospital, does BAMC have access? Yes. So Genesis, one of the things about Genesis is we can see your records from wherever you were in the military health system.
Tripler.
Including Tripler. Yeah. Yes, ma'am.
The PACT Act.
The PACT?
The PACT Act for Agent Orange, for those of us that served in Vietnam or other since that period of time. And we have to gather the paperwork to go forth to the VA to prove that we had X, Y, and Z conditions that may go back 25 years. Do you have access to records going back that far at BAMC when you were a patient at BAMC?
25 years. The question is about, how long do we have your records from if you were a patient at BAMC? And was 25 years so long ago that we wouldn't have your records? Mostly 25 years is so long ago that we wouldn't have your records. There's a few things that we would still have through the legacy lab system, but like all of the progress notes and things that people actually wrote in your chart, we don't have access to those from 25 years ago necessarily. CT results and things like that we may still have. They always tell you when you're transitioning or you're going through a change, like print out all your stuff, keep track of all your own stuff, because we can't guarantee that we won't lose it or it won't end up in a warehouse like Indiana Jones had or something like that. And that's still kind of what they recommend is like keep it yourself. But we do have lab stuff. Like when I started at Wilford Hall, it was 2001 and we were on CHCS, and we've been on CHCS for 20 years already, and everybody's lab results I could look up from 20 years ago, and those are still accessible to me. So lab and radiology results mostly are still accessible. Yes, sir.
Yeah, you have access to the VA records because they're very thorough.
Yes. The question is, do we have access to the VA records? And the answer is yes. It's through something called the Joint Legacy Viewer, JLV, which you don't necessarily need to know that, except that you can tell your doctor if they're confused and they're like, I can't see that. You'd be like, yes, you can. Look in the JLV. And then you'll find it. And it takes a while and it's kind of slow to load, and there's like hundreds of thousands of documents in there, but you can find it.
Would they be in St. Louis? These facts?
The records.
Legacy
stuff, it's somewhere.
Would they be in?
I don't know. I don't know where it is.
I think it's just personnel records in St. Louis.
Personnel records in St. Louis, maybe not medical records.
Yeah, we had to send to St. Louis in order to find because it was too far in the.
Maybe, yeah.
So I was just curious. Okay, thank you.
Sir, did you have a question?
Yeah, I was just gonna add to what you said. The National Personnel Records Center in St. Louis has an incredible amount of stuff that's been filed there. I found my records going back from the days that I was enlisted.
Is that right?
And showed up in the Army in the first day, as well as a lot of medical records included. So it's a pretty good resource if you've lost stuff elsewhere.
That's good to know. Thank you. Yes, ma'am.
This is something you already went over, but this is to clarify. In what instances can spouses or dependents use BAMC?
So the question is, in what instances can spouses or dependents use BAMC? And the answer is really, if you have benefits, if you ever had TRICARE, and if you have TRICARE for life, then you can use BAMC for emergency care, hospitalizations, specialty care on a space available basis, prescriptions, radiology, pharmacy, all that stuff. If you lost your eligibility because of a divorce or something like that, and you're no longer eligible for care, that's a different thing. But we don't differentiate by patient category of like, are you a retiree over the age of 65 or are you a dependent of a retiree over the age of 65 when it comes to space available care.
And you said something in there that threw me off. A divorcee.
So sometimes, it depends on the time. It depends on like how long you were married and when the divorce happened and stuff. Sometimes people, if they, you know, get a divorce while the person's still active duty or something like that, then the dependent doesn't end up eligible for TRICARE. But that's weeds that I don't know the details of. But generally speaking, if your spouse retired and you were a dependent when that person retired, then generally you're still eligible for care. And if you have any questions, you can contact beneficiary services and they'll tell you for sure. Last thing you want to do is show up and be told you're not eligible for care. Yes, ma'am.
Does BAMC have any urgent care, non-emergency room facility?
The question is, does BAMC have an urgent care non-ER facility? And the answer is BAMC does not, but WASC does. So Wilford Hall has that family emergency center, and it basically functions, it's actually counts as an emergency department, but it's really there mostly for lower acuity emergency care type urgent care stuff. And they actually are soon going to be starting to be able to get ambulances from outside places for low acuity patients, but mostly they're there to make sure that the patients that live on post and the trainees that are over there and the people that live on the west side have access to kind of some urgent resources besides driving all the way to BAMC. Other questions? Way in the back. Yes,
Are
ma'am.
all the specialty clinics at BAMC, or are they divided between Wilford Hall and BAMC?
Yes, I think everyone heard that question. And the answer is it depends on the specialty. Some of them we have at both places, and some of them we just have at one or the other. And that is a thing that undergoes some transition. Dermatology, we used to have at both places, and now it's just at WASC. Endocrinology, we had the DCOE, the Diabetes Center of Excellence over at Wilford Hall, and that's moved over to consolidate with endocrinology at BAMC at this point. So there's a little transition there. But mostly the subspecialty clinics are the same as they were in like 2011-ish when we finished with the BRAC, the base reassignment and closure.
Oh, so that's why I'm at Baptist. I imagine mine is specialty, I don't know, but I have lymphedema, and I couldn't get help at BAMC. And I couldn't get help, period, and for the longest kind of time. And someone mentioned the wound at Baptist, Northeast Baptist, and I went to my internal medicine, gave me a referral to that clinic, and everything has been smooth sailing.
Oh, good. I'm glad to hear that.
But
Any
you
last?
had nothing. I mean, I had none of the doctors could help me because they didn't know anything about it. So, I mean, I was very special.
Nobody wants to be special when it comes to healthcare, that's for sure. Nobody wants to be the interesting case either. All right, any other questions before we break? And I'll linger for a while. I don't have anywhere I absolutely have to be for some time. So I'll linger for a while where it's 10 degrees cooler in the hallway if you still have questions for me. But thank you for your attention. Thank you for being our patients. Really, it's an honor to serve you.
All right, ladies and gentlemen, before you go, just a heads up, we will be in the lobby. If you need the beneficiary text service information, and if you have a cell phone and you want to get the Access to Care app or the Access to Care guide. We will also be giving out what we have of the San Antonio market information booklets, and then coming back when we can, as soon as we can, with more of them. All righty?
Okay.
We'll see you in the lobby.
Thank you.